Hello everyone. Today we are going to learn about psychological theories. So first, let's see what is psychological theories. So psychological theories are theories in which, like talking theory, psychological theory is, collaboration to space or to explore your difficulties in a safe and confidential environment. Our aim is to help a better understanding of a person's feelings in the context of patient's past experience. So let's say one by one. Psychological theories. First is psychotherapy. What is psychotherapy? An interaction between a trained therapist and someone suffering from psychological difficulties. Who are all suffering with psychological difficulties? They can take a help of therapists to solve their problems. Electric approach. The most popular form of therapy is basically a smorgasbord where the therapist combines techniques from different schools of psychology. In this, we can choose which kind of therapies we want to select for particular problem. Therapists choose different techniques to deal with different problems of an individual or of a patient. So let's start with psychoanalytic theory. What is psychoanalytic theory? Sigmund Freud has developed this theory, Freud's therapy. Freud used free association, hypnosis, and dream interpretation to gain insight in the client's unconscious. There are three kinds of minds: unconscious, preconscious mind, unconscious, and conscious. So psychoanalysis was found by Sigmund Freud. Freud believed that people could be cured by making conscious their unconscious thought and motivations, thus gaining insight. The aim of psychoanalysis therapy is to release repressed emotions and experiences to make the unconscious conscious. It is only having a characteristic which is called healing experience can the person be helped and cured. And this what happens in unconscious mind. There are few things which therapists bring to person's consciousness. Psychoanalysis is a therapy as well as a theory. Psychoanalysis is commonly used to treat depression and anxiety disorders. In psychoanalysis, Freud would have a patient lie on a couch to relax, and he would sit behind them taking notes while they told him about their dreams and childhood memories. Psychoanalysis would be a lengthy process, involves many sessions with the psychoanalyst. Now, what are the methods we use? Psychotherapists use their techniques to overcome resistance by the client. The psychoanalyst wants you to become aware of resistance and together interpret its underlying meaning. Transference. In psychoanalysis, the patients transfer to analyst of emotions linked with their relationships. So this was about psychoanalytic theory. Next, we are going to see about behavior therapy. So what is behavior therapy? Therapy that applies learning principles to the elimination of unwanted behavior. The behavior are the problems, so we must change the behavior. Here are some techniques we use for behavioral therapy: systemic desensitization, floating and virtual reality exposure therapy, which is also called exposure therapy, and aversive conditioning. So the major group of behavior therapy is called counter conditioning, a classical conditioning therapy style which includes four major individual therapies which we talked about. Let's see in details what is behavior therapy. Behavior therapy is a short duration therapy. Therapists are easy to train and it is cost effective. The total duration of therapy is usually 6 to 8 weeks. Initial sessions are given daily, but the later sessions are spaced out. We can take some time in between. Unlike psychoanalysis, where the therapist is a shadow person, in behavior therapy, both the patient and therapist are equal participants. There is no attempt to underline conflict, and the patient is not encouraged to explore his past. In psychoanalytic theory, we tell them to recall their memories which happened in past, but in behavior therapy, we are not supposed to do that. So it is a form of treatment for problems in which therapists establish a professional relationship with the client and with the objective of removing or modifying existing symptoms and promoting positive personality growth and development. So there are few techniques of behavior therapy, which is called behavior technique. There are a few assumptions of behavior therapy. So let's learn. The first one is all behavior is learned, whether it is adaptive or maladaptive. Human beings are passive organisms that can be conditioned or shaped to do anything if correct responses are given and reinforced. Maladaptive behavior can be unlearned and replaced by adaptive behavior if the person receives exposure to specific stimuli and reinforcement for the desired adaptive behavior. Behavior assessment is focused more on the current behavior rather than on historical anecdotes. And treatment strategies are individually tailored. It means we can see for which kind of patient, which therapy or which techniques we can use. So behavior therapy techniques, let's see. First one is systemic desensitization, then floating, then aversion therapy, then operant conditioning produced for increasing adaptive behavior, then operant conditioning produced to teach new behavior. Operant conditioning produced for decreasing maladaptive behavior. And the last one is assertiveness and social skill training. So we are going to see step by step. Let's start. systemic desensitization, in that relaxation training, hierarchy construction, and desensitization of the stimulus, which we use for phobias, obsession, compulsions, and sexual disorders. So in relaxation technique, we can use Jacobson muscle progressive relaxation, which is called JPMR also, hypnosis, meditation or yoga, mental imaginary, and biofeedback we can use for relaxation. In hierarchy construction, patient is asked to list down the conditions which provoke anxiety, and then he is asked to list them in descending orders for anxiety provocation. In desensitization of the stimulus we use, this can either be done in reality or through imagination. At first, the lowest item in hierarchy is confronted. The patient is advised to signal whenever anxiety is produced, and with each signal he is asked to relax. And after a few trials, patient is able to control his anxiety towards a specific phobia or obsessional compulsions. Next is floating. What is floating? So floating is the patient is directly exposed to the phobic stimulus, but escape is made impossible. By prolonged contact with the phobic stimulus, the therapist guidance and encouragement and his modeling behavior reduce anxiety. Indications in which we use a specific phobia. In specific phobia, we made a patient or a person to expose a phobic stimulus, and we close all the doors so that escape is not possible, so that after prolonged contact they can reduce their anxiety by seeing their phobic stimulus. See, this process involves exposing people to fear-inducing objects or situations intently and rapidly. This is the example of floating. Next is aversion therapy. In aversion therapy, a pairing of pleasant stimulus with an unpleasant response, so that even in absence of the unpleasant response, the pleasant stimulus becomes unpleasant by association. Punishment is presented immediately after a specific behavioral response, and the response is eventually inhibited. Unpleasant response is produced by electric stimulus, drugs, social disapproval, or even fantasy. Indications: alcohol abuse, paraphilias, homosexuality, and feminism, transvestism. So this is an example of aversion therapy. Like when you have nail beating problem, you can apply a solution, bitter in taste, so that gradually you stop biting your nails. Next is operant conditioning procedure for increasing adaptive behavior, in that positive reinforcement and token economy. What is positive reinforcement? Is when a behavioral response is followed by a gradually rewarding event such as food, praise, or gift, it tends to be strengthened and occur more frequently than before the reward. This technique is used to increase the desired behavior. It means if patient is doing something good, we have to give them as a praise or reward. We have to give reward to them. And token economy It also involves giving reward for appropriate or desired target behavior performed by the patient. And token can be later be exchanged for other rewards. Like for example, we can take an inpatient hospital ward patient receives a reward for performing a desired behavior, such as token, which they may use to purchase a luxury item or certain privilege. Here also I have given an example: token economy, an operant conditioning procedure that rewards a desired behavior. A patient exchanges a token of some sort on for exhibiting the desired behavior for various privilege or traits. Next is operant conditioning procedure to teach new behavior, which is modeling, shaping, and chaining. So what happens in modeling? Modeling is a method of teaching by demonstration wherein the therapist shows how a specific behavior is to be performed, and in modeling, the patient observes other patients, including in target behaviors, and getting reward for those behaviors. So this will, make the patient to repeat the same behavior and earn rewards in the same manner. So this is modeling. Next one is shaping. What happens in shaping is the components of a particular skills, the behavior is reinforced step by step, and in this therapist starts shaping by reinforcing the existing behavior. Once it is established, the reinforce the response which are closest to desired behavior and ignores the other responses. Like for example, we can take like to maintain eye-to-eye contact, the therapist sits opposite to the patient and reinforce him even if he moves his upper body towards him. Once this is established, he reinforces the patient head movement in his direction, and this produces continuous till eye-to-eye contact is maintained. Next one is chaining. So what is chaining? Chaining is used when a person fails to perform a complex task, and the complex task is broken into a number of small steps, and each step is taught to a patient. In forward chaining, one starts with the first step, goes on to the second step, then to the third, and so on. In backward chaining, one starts with the last steps and go on the next step in backward session. And backward chaining is found to be like more effective in training mentally disabled. Next one, operant conditioning procedure for decreasing maladaptive behavior: extinction, ignoring, punishment, timeout, restitution, overcorrection, and response cost. So in ignoring, it means like removal of attention reward permanently following a problem behavior, and this includes action like not looking at the patient, not talking to the patient, or having no physical contact with the patient. And this be used when a patient exhibits an odd behavior. Next one is punishment. Aversion stimulus punishment is presented contingent upon undesirable responses. The punishment procedure should be administered immediately and consistently. Here, explanation. Next one is timeout. What is timeout? Timeout method includes removing the patient from the reward or the reward from the patient from time following problem behavior. And this is often used in the treatment of childhood disorder. Like for example, child is not allowed to go out of the ward to play till he fails to complete his given work. Restitution, which is overcorrection. Restitution means restoring the disturbed situation to a state that is much better than what it was before. Problem behavior, like we can take an example. If a patient passes urine in the ward, he would be required to not only clean the dirty area but also mop the entire area of the floor. Patient is making a mistake, so he's correcting that. And response cost, that's one. This procedure is used to individuals who are on token programs for teaching adaptive behavior, and when undesirable behavior occurs, a fixed number of tokens or points are deducted from what the individual already earned. So if patient or person is showing any other kind of behavior other than desired behavior, so we can take a token from them and we can deduct that which they earn during token program. And the last one is assertiveness and social skill training. Assertive training is a behavior therapy technique in which the patient is given training to bring about change in emotional and other behavioral pattern by being assertive. Social skill training helps to improve social manners like encouraging eye contact, speaking appropriately, observing simple etiquettes, and relating to people. So this was the technique of behavior therapy. Now we are going to see cognitive therapy. What is cognitive therapy? A therapy that teach people new, more adaptive ways of thinking and acting based on the assumptions that thoughts intervene between events and our emotional reactions. So cognitive therapy is a psychotherapeutic approach based on the idea that the behavior is secondary to thinking. Our moods and feelings are influenced by our thoughts, and self-defending and self-depreciating patterns of thinking result in depressed mood. The therapist helps the patient by correcting this restored way of thinking, feeling, and behavior. Cognitive model has 3 steps: negative view about self, a negative view about the environment, and negative view about the future. The negative thoughts are modified to improve the depressive mood. Cognitive therapy is used for treatment of depression, anxiety, panic disorder, phobic disorder, and eating disorder. In this, see, they have given in chart, like if person is losing a job, what his internal belief is, I'm worthless or I'm hopeless, that leads to depression. And in second example, a person is losing a job and his internal belief is, my boss was not good and I'm deserving something better. It means he is showing his belief in a positive manner. So if person is positive about particular situation, so he will not be going to depression. So there is no depression. Next one is hypnosis. The word hypnotism was first used by James Braid in 19th century. Hypnosis is an artificial induced state in which the person is relaxed and unusually suggestible. Hypnosis can be induced in many ways, such as by using a fixed point of attention, rhythmic, monotonous instruction, etc. Changes that occur during hypnosis: the person becomes highly suggestible to commands of the hypnotist. There is an ability to produce or remove symptoms or perceptions, dissociation of a part of body or emotions, and amnesia for the events that occurred during the hypnotic state. Now, what are the techniques we use for hypnosis? Is a patient is either made to lie down on bed or sit in the chair. He is asked to guess fixedly on a spot. Therapists make monotonous suggestions of relaxation and sleep. The patient, however, is not asleep and can hear what is being said, whatever therapist said, and answer questions and obey instructions, like abreaction of past experience, psychosomatic disorder, conversion or dissociative disorder, eating disorder, habit disorder, and anxiety disorder. Next is Abreaction Therapy. Abreaction is a process by which repressed material, particularly a painful experience or a conflict, is brought back to consciousness. The person not only recalls but also relieves the material, which is accompanied by appropriate emotional response. It is most useful in acute neurotic conditions caused by extreme stress, which is example like post-traumatic stress disorder or hysteria, etc. Which method we use? Abreaction can be brought about by encouragement to relieve the stressful events. The procedure is begin with neutral topic at first and gradually approaches areas of conflict. It means we can go from simple to complex. And although abreaction can be done with or without the use of medication. Next one is relaxation therapy. Relaxation produces physiological effect opposite those of anxiety, slowing heart rate, increased peripheral blood flow, and neuromuscular stability. There are many methods. First is Jacobson progressive muscular relaxation, which is called JPMR, mental imaginary yoga or meditation, biofeedback. Next one is individual psychotherapy. Individual therapy is a psychotherapy implemented by trained professional, usually a therapist or psychologist, to help a client work through a problem. The way that individual therapy is implemented varies widely depending upon a psychological problem experienced by the client and the personal beliefs and practices of the therapist and the individual needs of the client. What are the indications in which case we use individual psychotherapy? Stress-related disorder, alcohol and drug-dependent, sexual disorder, and marital disharmony. Next is supportive psychotherapy. The therapist helps the patient to relieve emotional distress and symptoms without probing into the past and changing the personality. What are the techniques they use? Ventilation, environmental modification, manipulation, persuasion, re-education, and reassurance. So what happens in ventilation? It is a free expression of feeling or emotions. Patient is encouraged to talk freely, whatever comes in his mind. And in environmental modification, like we can improve the well-being of mental patients by changing their living conditions. Persuasion here, like a therapist attempts to modify the patient's behavior by reasoning, re-education, education to the patients regarding his problem, way of coping. We can teach them, and reassurance. Next, let's see about group therapy. Group psychotherapy or group therapy is a form of psychotherapy in which one or more therapists treat a small group of clients together as a group, sections, homogeneous group, adolescents and patients with personality disorder, families and couples where the system needs change. In contraindications, antisocial patients is not included in group therapy. Active, suicidal or severely depressed patients who are delusional or who may incorporate the group into their delusional system. Group size may be 8 to 10 members, and the frequency and length of session they conduct once in a week. A session, and it may last to 45 to 1 hour. So what happens in group therapy is, like, the therapist primary role is that facilitator. He provide a facility. He should provide a safe environment or comfortable atmosphere for self-disclosure. They focus on here and now. Use any transparent situation to develop insight into their problems, protect members from verbal abuse or from scoldings from others. Whenever appreciate, they provide a positive reinforcement. This gives a ego support, and they get motivated. Handle a circumstantial patient, hallucinating and delusional patient in a manner that protects the self-esteem of individual and also sets limit on behavior so as to protect other group members. They develop ability to recognize when a group member is fragile. They use silence effectively to encourage introspection and facilitate insight. Laughter and a moderate amount of joking can act as a safety valve, and at times can contribute a group cohesiveness, and role playing may help a member to develop insight into the way in which he relates to others. So this was the approach which we use in group therapy. Next, therapeutic factors involved in group therapy: sharing experience, support to and from group members, socialization, imitation and interpersonal learning. Next one is psychodrama. What is psychodrama? So psychodrama is a specialized type of group therapy that employs a dramatic approach in which a patient's behavior becomes actor in life situations or scenario. The goal is to resolve interpersonal conflicts in a less threatening atmosphere than the real life situation would present. In psychodrama, the patient is brought directly into the situation as an active participant. The direct or coordinates the process so that the group and the protagonist receive maximal benefits. Other group members act as auxiliary egos and play the role of significant other with whom relationships are being explored. Next one is, and last one is, family and marital therapy. Family therapy is a branch of psychiatry which sees an individual psychiatric symptoms as inseparably related to the family in which he lives. So our focus of treatment is not the individual but the entire family. And today most family theorists identify the individual's problem as a symptoms of trouble within the family. So an indication in which cases we can use family and marital therapy. whenever there are relational problems with a family or marital units, which can occur in almost all type of psychiatric problems, including psychosis, reactive depression, anxiety disorder, psychosomatic disorder, substance abuse, and various childhood psychiatric problems. Types of family therapy: individual family therapy, conjoined family therapy, couples therapy, multiple family group therapy, multiple impact therapy, and network therapy. So let's see in individual family therapy what happens. In individual family therapy, each family member has single therapist. The whole family may meet occasionally with one or two of the therapists to see how the members are relating to one another and work out specific issues that have been defined by individual members. Next one is conjoined family therapy. The most common types of family therapy is single family group or conjoined family therapy. The nuclear family is seen in this, and the issues and problems raised by the family are the ones addressed by therapists. The way in which the family interacts is observed and become the focus of therapy. Therapist helps the family deal more effectively with problems as they arise and are defined. Couple therapy. Couples are often seen by the therapist together. The couple may be experiencing difficulties in their marriage, and in therapy they are helped to work together to seek resolution for their problems. Family patterns, interactions, and communication styles, and each partner's goals, hopes, and expectations are examined in therapy. This examination enables the couple to find a common ground for resolving conflicts by recognizing and respecting each other's similarity and differences. Next one is multiple group therapy. In this, 4 or 5 families meet weekly to confront and deal with problem or issue they have in common. Ability or inability to function well in the home and community, fear of talking to or relating to others, abuse, anger, neglect, and development of social skills and personality and responsibility for oneself are some of the issues on which this group focuses, and the multiple family group becomes the support for all the families. The network also encourage each other to reach out and form new relationships outside the group. Next one is multiple impact therapy. In multiple impact therapy, several therapists come together with the families in community settings. They live together and deal with the issue in each family members with the context of the group. Multiple impact therapy is similar to multiple family group therapy, only the difference is that more intense and time limited problem will be there. The session will be more intense and there will be a limited time. Like multiple family group therapy is focused on developing skills or working together as family and with other families. And the last one is network therapy. Network therapy is conducted in people's home. All individuals interested or invested in a problem or a crisis that particular person or person in a family are experiencing to take part. This gathering include family, friends, neighbors, professional groups, or person and anyone in the community who has investment in the outcome of the current crisis. People who form the network generally knows each other and interact on a regular basis in each other's lives. So the network may include many as like 40 to 60 members. And so this was all about our therapies, which is called psychosocial therapy. Today we have seen psychoanalytic theory, therapy, behavior therapy, then we have seen cognitive therapy, then hypnosis, abreaction therapy, relaxation therapies, individual psychotherapy, supportive psychotherapy, group therapy, and family therapy. Thank you.